Hi, everyone. My name's Kristine. I'm a family nurse practitioner and I'm certified in menopause through NAMS. You may know of it as the Menopause Society. I'm also a weight loss expert. I founded Empowered Women's Telehealth, which is a clinic here in Austin, Texas. So I like to do a lot of education around menopause to support you as you go through this journey. I know a lot of us are getting just all the information about perimenopause right now on our social media. And it's really hard to know what's real and what's not, and what resources you can trust. So I thought I would do a little presentation today, really speaking to, all the questions I got from our brunch social this weekend. And, talk a little bit more about how you can find a menopause provider in your area. All right, so let's get to it. So this past weekend, we had a menopause brunch social, and most of the participants had questions around perimenopause. So I thought I would just make a quick video to talk a little bit more about this, since it seems to be a um, common question people have. What is perimenopause? There's a ton of information suddenly online about perimenopause you may be getting marketed to, and so a lot of women want to know what it is. How do I know if I'm in it? So perimenopause is simply the transition phase leading to menopause. So, menopause is just when you've gone 12 months without a period. And so, it's the time leading up to that. Normally, menopause is the age 45 to 55 in the US. And so, perimenopause can last 7 to 10 years leading up to that. So, it's quite a long time. Usually, one of the first signs of this is changes to your menstrual cycle. So, that's generally what women will start to notice. And that could be a variety of things. Maybe you're skipping your cycle, or you're having heavier bleeding or lighter bleeding. Maybe the length of your cycle is longer or shorter. So, really, any changes to your menstrual cycle. So, what are some common symptoms of perimenopause? We've all heard about night sweats and hot flashes, but it's really different for everyone. So, if you're not having those, it doesn't mean you're not in perimenopause. You may also notice sleep disruption. Sometimes it's 3 a.m. and then you can't go back to sleep, right? So that's sleep disruption. And maybe for you, it's just harder to fall asleep. And of course, mood changes. So maybe you're finding you're easier to get upset with your partner or your kids. And then you can have some vaginal symptoms of menopause. So, vaginal dryness, maybe it's painful to wipe when you go to the bathroom, or having painful sex. And of course, decreased libidos. So, that desire to have sex is lower, maybe not even there. So, it could be anything from your hair is falling out to skin changes. So it's really unique to everyone. So there's no one size fits all with menopause and perimenopause. All right. So the other really common question I get is, how do you diagnose menopause or perimenopause? Do I need labs? So both perimenopause and menopause are diagnosed without labs. I would say the common story is, I went to my PCP or my OBGYN, and they drew labs and everything was normal. And so they sent me home, right? With, no guidance, no medication. Well, menopause is not diagnosed with labs, neither is perimenopause. We diagnose it based on your history, right? So your history, your menstrual cycle, those changes, your last menstrual cycle, and any symptoms that you're having. So it's what we call a clinical diagnosis, and you don't need labs for this. I know we're in a data driven world, and a lot of women like labs. So, usually, what I say is, if you're my client, I'm happy to order it. And sometimes it's more confusing than helpful. So, in the perimenopause phase, what's happening is you're having a fluctuation of your estradiol levels. Some days it may be high, the very next day it may be low. And so, a high estradiol doesn't mean you're not in perimenopause, right? You would have to check it several days over time to really get a good picture of what is going on there. And so, one point in time isn't going to tell us a whole lot. Same thing with FSH. That's another one we can look to. If it's greater than 25, that generally indicates menopause. You'll notice I'm saying indicates because, again, we don't use one lab at one point in time to diagnose menopause. It's generally trending. So we have several over time. but it's not needed. And so there's a really small window where you'll catch that elevated FSH, and outside that window, it can be normal. So it doesn't mean you're not in perimenopause if it's a normal FSH or normal or high estradiol. It doesn't exclude it. So, if you're having symptoms of perimenopause, and it's disruptive, right? You're having changes in your mood that's causing problems maybe with your marriage or your kids or your partner, or you're having trouble sleeping and you're experiencing brain fog during the day, or, like I said, the night sweats. Personally, that's my issue right now is night sweats, and it's interrupting my sleep. And then I'm having a hard time concentrating during the day. Some things that everyone can do is focusing on eating a healthier diet, regular exercise, of course, not smoking, and decreasing your alcohol and sugar intake. Both alcohol and sugar, especially at night, can worsen night sweats and that sleep disruption. So, really limiting those. And of course, it can add to that abdominal fat that we may be experiencing during perimenopause. Our body tends to change where fat goes, so that redistribution to our abdominal area. And so we can experience some weight changes during this phase. And then, of course, working on stress management, that's going to help with your overall sleep. So, really focusing on sleep hygiene. And then, so those are just some lifestyle modifications that we can all do. Now, of course, there's also hormone replacement therapy. Now, this is first line for hot flashes, night sweats. We also consider sleep disruption as part of that now. And then osteoporosis prevention. There are other symptoms, though, if you're not having any of this, there are other symptoms that we would do a trial. So, for example, depression is a really common one where we would trial hormone replacement therapy. And if we don't see any improvement in 6 months, then we would likely recommend discontinuing and trying something else. We would at least evaluate if continuing is an appropriate plan. And of course, always making sure you're getting additional labs to rule out other conditions like thyroid conditions can often mimic menopause, so making sure that that's not going on. And sometimes it can be both. Birth control versus hormone replacement therapy, which one's right for you? Generally, birth control is really great if you are having irregular, heavy periods, if you're wanting to prevent pregnancy, and then for certain conditions like PMDD and PCOS. Now, if none of that applies to you and you're really just wanting it for the symptoms of perimenopause that we talked about, then going with hormone replacement therapy, which is going to be a fraction of the hormones in birth control. It's also hormone replacement therapy, or HRT, is bioidentical. So it's going to be most similar to what your body produces. The only way you could get it closer is if you hooked yourself up to another woman who is still producing these hormones. So it's the closest that we have that mimics what our body currently makes, and it's less potent. Think of it as topping off what your body is already making, where birth control will actually stop your ovaries from producing hormones, and you're getting all of your hormones from the birth control. So with hormone replacement therapy, we're just replacing what your body is missing, and that should create more of a steady serum level so you're not having those fluctuations. And then it's not going to have any impact on your ovulation. So it's not going to prevent pregnancy. It's not really going to regulate your bleeding, although we can always adjust or play around with the progesterone piece to help with that. So if you're still having a period, you'll continue to have a cycle. And if there's still that risk of pregnancy, then we want to use other forms of birth control, like, condoms, or you could even consider pairing it with an IUD, like the Mirena. So that would be good up to 5 years when paired with the estradiol patch to prevent pregnancy. But we're also using progesterone and progestins to prevent hyperplasia of the uterus, which can increase your risk for cancer if not taken with the estradiol. Think of the estradiol as the hormone that increases that tissue, where the progesterone has our body shed that lining every month. And so that's why we have a period. And so that's what we're using it for in this case, so it doesn't become too thick. I think we talked about this pretty well, but again, just to summarize, when you might benefit more from birth control if you're trying to regulate your periods, that heavy bleeding, you could also consider the IUD, and then preventing pregnancy and treatment of PMDD. That's where you're having that cyclic mood changes, so depression right before your cycle. So, I was having that like once a month and finally realized that it was just, 1 week out of the month that I was kind of having this cyclic depression, anxiety, and started on oral birth control, and it leveled that out. And then also PCOS. If none of that applies to you, then you could always start with a hormone replacement therapy. There's no right or wrong here, right? As long as there's no contraindications, you could always start with one, and if that didn't work, try the other. It's something that came up a lot during our event was just that a lot of women have already seen a provider for this, right? And, there was a lot of gaslighting experience that had happened, and maybe they got some bad advice. And so, if you're still struggling with those symptoms and you feel like your provider's not taking you seriously or they didn't offer you any treatments, it's really important to get a second opinion. Just looking at the length of time that perimenopause lasts, 7 to 10 years, that's a really long time to just ignore your symptoms and suffer. We can probably, most of us can relate to, our parents, for me, mom and stepmom, who they didn't have access to hormone therapy. And that was because of the WHI study that came out 20 years ago that was really flawed. But the immediate response to that study was that providers stopped prescribing hormone therapy. And so, our parents' generation didn't have treatment options for menopause. And so a lot of those women really suffered, especially with, the just looking at the mental health aspect of it, right? So they didn't have adequate care. And so, something that's really different for our generation is that you do have access to menopause experts that can help you through this transition. There's no reason that you have to go through this alone, and there's no reason that you need to suffer. We have really safe and effective forms of treatment, and we now know how flawed the WHI study was. That most of the women in that study were over the age of 60, and so, of course, they were at higher risk for clots and for breast cancer because as you get older, those risks increase. It's what's known as the timing theory, and that it matters when you start hormone therapy. So, the younger you are when you start, the better. So, it's not recommended for anyone over the age of 60 or last menstrual period more than 10 years ago. So, for some women, they may have a period up until the age of 60 and they would still qualify for treatment in that scenario. But again, it's important to talk to a healthcare provider to go over your individual history to make sure that's the right treatment for you. Now, I included in here at the very bottom, you'll see NAM's provider directory. If you go to the Menopause Society, and I'll pull it up so you can see it, or you just type in NAMS providers, what you'll find is a directory of providers who are certified in menopause. All right, so let's just really quick go through how to find a menopause provider near you. So if you search NAMS, that's NAMS, on Google and you type in provider, it's going to bring you to the Menopause Society. So this is their page. From here, you can select either zip code or you can do by telehealth. If you're in a state that maybe doesn't have a lot of local providers, then telehealth's a really great option. Since I'm in Austin, I'll just go ahead and show you how to use the zip code. So we'll put in our zip code for Austin, Texas. And then from there, it's going to bring up all the providers closest to you. So you'll see, I'm listed here. I'm Kristine Groemping, and then the link to my website. And you'll also see our social media handles where you can learn more about us and just additional information about menopause. And then, of course, there are other providers, so you can go through and click on their links to learn more about their options. All right. And that was it for today. So, I hope you found this useful. If there were any questions I didn't get to that you would like for me to talk about next time, please leave a comment and I'll make another video about that. So, Also, please like and subscribe us so that it will help other women going through menopause find our channel. And then we will be planning another social again soon, so I hope you consider joining us. All right. Thanks, everyone. Bye.